Feel kind of bad for this other orthodontist because they didn't even give him a chance. You can pull off a lot of good things if you have the right strategies and techniques. Welcome back. Thank you so much for tuning in. Dr. Braces here. Recently, a topic has come up, and you're seeing a lot in the news about autism. The number one message I wanted to get across is if you do have autism, you are a part of society, you do have a place, and you're certainly welcome here, especially in my office. Now, when we talk about treating patients with autism orthodontically, just like any other patient, there's two options, right? We've got braces, we've got Invisalign. Now, we have to pick the right appliance that's going to have the least sensory impact. And what I mean by sensory impact is how much do they feel it? How much does it bother them? How much does it potentially cause them, overstimulus? According to Google, the best treatment for autistic patients is Invisalign. It's from the AI portion of Google, and it's probably put on there by Invisalign themselves. So you can't always trust what the AI tells you. Now, but here's why that's a viable and important statement. Because here's your braces, here's your Invisalign. Now, what you're going to notice is that braces are much thicker, they're much sharper, they're not as smooth, and so it's going to cause a lot more sensory impact than Invisalign. Whereas Invisalign is clear, which doesn't matter quite as much, but it's smooth, right? It doesn't protrude out from the teeth, which is what braces do. So a lot less sensory impact when it comes to Invisalign. So that is certainly a true statement. As far as the sensory impact goes, Invisalign is going to have less of a sensory impact than braces will. Now, what I've found in my practice in treating autistic patients is there's also a compliance factor, and that's the same with any patient. With Invisalign, you have to wear them. And if you don't wear them, they're not going to work. And so in my experience, patients with autism do better with braces because if it's causing, oversensation, overstimulus, if you can take it off, you will, right? So if the patient they're overstimulated by the Invisalign and they know I can just take these off because I don't like it, they will. And so what I've found personally in my experience that fixed appliances, something that's glued on, works better. And that's not the case for everyone. There's obviously every patient is different, but for the most part, that's a blanket statement. But for the most part, my patients with autism tend to tolerate the braces better because they're fixed on their teeth. So yes, the first few days of that sensory overload is challenging, but once they get used to it, it tends to be okay. Whereas with Invisalign, they just say, I don't like these, I'm not wearing them, right? And so that's where it's a little bit more challenging. So what I've done in my practice is I have the same conversation. This is how Invisalign works. This is how braces works. The Invisalign will not work if you do not wear them. And majority of the times the parents know and they say, I think let's try the braces first. So that's the route that we go. I'll give you an example of one patient. He came to us. I would consider him low support needs, meaning, he's very good at communicating. Actually pretty funny. He's very good with names and he's very good with dates. And so everyone in my office, he knows all of our names and he knows all of our birthdays. My treatment coordinator is Kelly. And every time he sees Kelly, he says, Kelly, I like your name because Kelly can be a boy's name or a girl's name. And Kelly, your birthday is on. And then he goes on to tell her when her birthday is. And so when I first met this particular patient at the consult, they came to me and they said, we've already gone to see another orthodontist. They evaluated his case and they said, we shouldn't do orthodontics on him. Personality-wise, it's not going to be a good fit. He's not going to be able to tolerate it. And that was kind of sad to me that they didn't even give him a chance. So I said, hey, let's try it, right? Let's see how well he does. Let's see how well he tolerates these braces. We talked about braces and Invisalign. They chose braces. And he had an impacted tooth, which means one of his teeth was stuck and it wasn't going to come down on its own. So surgically, we have to go access that tooth and bring it down. And I just said to Mom, listen, let's give the braces a try. If it's working great and he's tolerating it well and he's able to keep it clean, fantastic. We'll go ahead and try to bring that tooth in. If he's not tolerating it well and we just decide it's not going to work, then I will recommend that the surgeon takes that tooth out and we plan for an implant later in life, or we just have a space there. And so Mom was totally fine with that. She's like, I just want to try. So we got him into braces and he's fantastic. No problems. He struggles with hygiene, but that's pretty much any teenage boy is the same, right? So he struggles with hygiene, but he's doing a good job with the braces. He's not pulling them off. He's leaving them alone. He's gotten used to them. He loves coming to the office. And at this point, he's one of our favorite patients, actually, within the office. Everyone loves him. And I feel kind of bad for this other orthodontist because they didn't even give him a chance. And the main thing is, you can pull off a lot of good things if you have the right strategies and techniques. Now, another patient, this is a patient that's high support needs. He still has the ability to communicate, but it's usually just one word. We're doing a procedure where we're having to put a little pressure. He might say hurts. Or if you are talking about lunch, he might say Sammy's, which is a restaurant near our office that he likes to go to. But kind of limited on his abilities to communicate and much more prone to sensory overload. And so with this particular patient, the way that we started him was, let's just get him comfortable in the office. So his first appointment after his consultation, we didn't do anything. We didn't put braces on. We just had him back and we let him sit in the chair. We let him sit in the chair. I had a conversation with him. I had a conversation with his father. He actually had a home therapist as well that was there that day. And so we just kind of sat in the chair for about 20 minutes and we just talked. I mean, that was all we did. Second time he came in, what did we do? We took it a little bit further. We let him sit in the chair. We leaned him back in the chair and we let him lay there for 10 or 15 minutes just to get used to that chair going back and being reclined. The next time we came in, we needed to get an impression on him, which, now we use a scanner, we wouldn't need to do, but we just put the impression tray in his mouth. We didn't actually take the impression. We just let him, and we did it, multiple times. We let him get used to feeling that stimulus. And we got him all the way to the point where we got him through braces. But we had to go slow with him. We had to make sure that we were explaining everything that we were doing. We had to, take extra steps that we wouldn't normally take. And again, as long as you're meeting their needs, that's the main thing, and not overloading the sensory, stimulus, then majority of patients are treatable. In this particular case, like our strategies that we would use, for example, is we would have him come in close to our lunch hour, which is our slowest time of day. Almost always we would put him in a time slot where there was no one else here. And so he's not coming in and being stimulated by other people being there. We seat him in the same chair every time. Sometimes we would we'd take him into our scanning room, which is a separate room. And so he's sitting in the same chair every time. He's in the same position every time. We turn the music off when he comes in because we don't want to, again, overstimulate him. So we turn the music off. We have, sometimes stuffed animals or something we'll give for him to hold while he sits there. The one thing I need to get is weighted blankets, but that's another thing we could do if he was having a bad day. And again, sometimes he would come in, we'd do everything that we normally do. We lean him back and he's just not having it. And I would just look at Dad and Dad would look at me and we kind of understood, today's not the day. Let's have him come back next week and we'll try again. And Dad would usually explain to him, okay, today, you weren't cooperative. We're going to come back next week. And he would just say, next week, but sometimes you would have great days. Majority of the times we would. Occasionally we had to reschedule. Those are the kind of steps that you have to take for a patient that's high support needs. And that's really important to understand that, again, just like every other patient, no two are the same. You got to take different approaches for every single patient that you see. We have strategies for it, and we want them to know they are a part of society. They're welcome here, and we are more than happy to take those cases on. Again, we have to understand there's extra steps. It's going to take longer. It's going to be challenging, and those are the things that we can do, though, to make sure that we are, making sure they have the opportunity and the access to care that anyone else does. Now, we talked about how, in my experience, majority of patients with autism, I recommend braces simply because they can't take them off. And if you have that sensory overload, if they can't take them off, they're going to get used to them and not just kind of throw the Invisalign trays out. Now, I had another patient, he was high masking, meaning extremely intelligent, maybe just didn't pick up on social cues. I did his case with Invisalign and it worked very well. And he was one of the most compliant Invisalign cases that I've ever had from a teenager standpoint. I mean, he was he wore those things exactly how we directed him. So again, I just want to stress that just like with any other teenage patient, I'm going to go through the exact same conversation as I am with any teenage patient. That this particular patient took the instruction that I gave him and said, okay, I am going to commit to this and I'm going to do it. And he certainly did. For some kids with autism, Invisalign is going to be a better option. For some kids, braces is going to be a better option. And that's the same conversation that I have with every patient that walks in my door, regardless. And so I want to just stress that point that you can go either way. We have to just decide what's best for this individual and their needs, what's going to get them not just the best result, but the best experience along the way. Patients with autism, they're welcome in a lot of orthodontist offices. You just have to ask the right questions. Make sure that office is willing to take those extra steps, because there's some offices that are just, you would call them like some people refer to them as factories, right? You go in, every patient's treated the same. Every patient is, expected to be in this same kind of like assembly line. And so if they're not willing to take the extra steps to treat patients that are autistic, then probably not the right choice for you. But they're out there. I promise you, they're out there. If you want to know how to choose the right orthodontist for you, click here. And thank you so much for tuning in. Remember, smiles change lives, so keep smiling.